Good morning, everybody! Kumusta po kayo lahat? Anyway, may commercial pala tayo, ano? Anyway, so yun. So, kumusta po kayo? It's me again, John. It's been a while. Tagal kong nawala. But I am back, finally, Anyway, hello muna kay Coach Jam. Kumusta ka dyan sa Middle East? I hope to see you once you're back in the Philippines. Kasi, alam mo naman, may nga schedule tayo na sana mag-meet tayo sa Pilipinas soon. Anyway, mabilisan lang to, para makapag-online din ako kahit na paminsan-minsan. So anyway, good morning po pala sa mga estudyante natin dyan sa Pilipinas ngayon. And of course, to all my friends here in the US. Hello, good evening po. And of course, hello to Sir Ian, John, Sumagaysay, and to Cham. They're on their way here in Minneapolis. Kagagaling lang nila nasa duty. Coach said nasa Pinas ako ngayon. Buti ka pa. How long will you be staying there? Anyway, hi to Christine Ann. Hi there. So, tawag dito. So, my friend Oliver messaged me and said, John, magpa-discuss nga ng heart failure. Kasi sabi niya, lalo daw yung mga, yung ejection fraction, something like that. So, okay. So I decided to, I'll just do it live para isang discussion na lang. Para naman may topic ako ngayong gabi, di ba? And may bagong lahat, hello to Mayang. Sabi, hello Sir John, Hilarica Fort, amping always. Thanks a lot. Anyway, so we'll talk about heart failure, guys. So just a disclaimer muna. Whatever I'm going to say tonight, do not take this as your sole management or treatment plan for whatever cardiac abnormalities or cardiac diseases or cardiac disorders you have. Okay? You really have to go to your cardiologist. You have to talk to your doctor for the appropriate treatment plan. So just a disclaimer. Okay, and hello to Raw Salt Montera. Hi there. Thanks for watching. Ano araw ba ngayon? Today is actually March 23rd and today is Thursday. And it's 9:20 po ng gabi. And I bet it's 10:20 ng umaga, March 24. That's Friday in the Philippines. Just until April, I'm all ears now. Let's go. Okay, coach. So yun nga, heart failure. So what is heart failure is all about? Alam niyo ba ang dami mga tao sa buong mundo na may heart failure? Okay? So in general, ang dami po mga pasyente may cardiac problem, ang daming pasyente may kidney problem, ang dami pong pasyente may endocrine problem. So why? What's the reason behind it? Most probably sa mga kinakain natin, sa lifestyle natin, am I right? Sa mga pinaggagawa natin sa katawan natin. Okay? Anyway, sabi pala ni Rosefoot Montera, hello Sir John, ingat po lagi dyan, Ramadan Mubarak. Ay, oo nga pala, Ramadan ngayon. Ramadan Mubarak sa mga kapatid po natin mga Muslim. Ramadan Mubarak. How long? That will be 1 month, right? So anyway, so let's talk about heart failure. So anyway, if you have any questions, guys, let me know. Drop a message, and I will try to answer those questions. Okay, so let's start. Okay, let's talk about heart failure. So what is heart failure? By the way, let me share my screen. Where is that? Present. Share screen. There. What's going on? Ba't ayaw niyo mag-share? Okay, cancel. Let me share my whiteboard. There. Anyway, kumusta kayo, guys? Entire screen. There. Share. There you go. So let's talk about heart failure. Okay. So, Sir John, what is heart failure? Ano ba yung heart failure? Failure of the heart. Heart failure of the heart. Yes. So technically, pag sinabi po nating heart failure, okay, heart failure, it means to say that the heart failed to pump well. Okay. So technically, when you say heart failure, it refers to inability of the heart. Okay. Inability of the heart to pump well. So ang tanong, bakit kailangan ba mag-pump ng heart ng maayos? Why is it important for the heart to pump well? What is the significance? What is the importance of your heart? Oh my God. Sir Ian is actually calling me right now. I'll talk to you in a bit, friend. Oh my God, stop calling me, friend. Okay, stop calling me, Beshi. I'll call you in a bit. Let me finish this stream. So, inability of the heart to pump well. So, why is it important for the heart to pump well? Well, the main reason why the heart needs to pump well is that uh, we know for the fact that when the heart contracts, when the heart pumps, it circulates blood around the body, right? It circulates blood around the body. Naalala ko tuloy yung advertisement ni Shaira. Do you know Shaira? If you're from the Philippines and you're particular with Promil user since birth, may isang advertisement doon na si Shaira ba yun? Shaira or Shaira yung pangalan? I don't know how to say her name. Maybe it's Shaira or Shaira. Promil user since birth. Sabi ni Shaira, cardiovascular system is a system that circulates blood around the body. Tama po yun. Okay? So technically, when you say heart, the cardiovascular itself, the heart pumps the blood out. So why is it important for the blood to be pumped throughout throughout the body? Because the body, okay, needs oxygen, the body needs nutrients, the body needs electrolytes, the body needs fluid. Okay, and take note, the heart, when the heart pumps the blood out, that blood serves as medium for transport. Okay, that blood contains oxygen, it contains nutrients, it contains essential products to maintain cellular activity. That is why if your heart failed to pump effectively, okay, if your heart failed to pump effectively, the distribution perfusion of those essential key products are actually impaired or affected. As a result, it will also affect the normal cellular activity. Okay, it will also affect the normal activity of the cells, normal activity of the tissue, normal activity of the organ. Okay? So, importante po mag-pump ng maayos yung heart para may blood supply, okay, yung mga organs natin, vital organs sa katawan. So pag hindi siya mag-pump ng maayos, ibig sabihin walang nutrient, walang blood supply ang brain, walang blood supply yung kidney, it will affect blood supply perfusion to your lungs and to the different vital organs in the body. So yun yung ganun po kaimportante yung heart pumping mechanism. Okay? Anyway, hello to Genesis Lewis. Thanks for watching. So if the heart failed to pump well, it affects perfusion of nutrients, perfusion of gases. So technically, pag sinabi pala nating heart failure, there is no problem with the heart rate. Okay? So the issue in your heart failure is pumping mechanism, not tachycardia, not bradycardia. By the way, tachycardia refers to increase in the heart rate, a heart rate greater than 100. Bradycardia means a slow heart rate that's less than 60 for adult and less than 100 for children, right? So wala pong issue na tachycardia or bradycardia sa heart failure. The issue in your heart failure is pumping ability of the heart, the pumping mechanism. I just want to make it clear. There is no problem with the heart rate. The issue in your heart failure is the ability of the heart to pump well. Okay? So, bakit ba nagkakaroon ng heart failure? Nagkakaroon ng heart failure because of several reasons or several causes. Before I will discuss that, I need to touch first a quick touch about the physiology and the anatomy of the heart. Okay? So dito natin ipapasok yung ejection fraction, yung mga preload, afterload, then we will talk about the different types of heart failure. Okay? So gaya ng sinabi natin, where's that whiteboard? Here. So if this is our heart, okay, if this is our heart here, our heart is divided into 4 chambers. Okay, this is very elementary. So this is the right side of the heart and this is the left side of the heart. This is what we call the right atrium, This is the sorry, the right ventricle. What happened to me? Okay, this is the left atrium. This is the left ventricle. So technically two sides. And these two sides are actually separated by a septum. Okay? The right side of the heart receives blood from your systemic circulation, from superior and inferior vena cava. Okay? The left atrium receives blood from your lungs. Okay? And the left ventricle will pump blood going to your aorta. Correct? It's very simple. So, ito yung story. When the right side of the heart is filled with blood, okay? Palitan natin yung kulay. Okay. When the right side of the heart is filled with blood, okay? Filled with blood. Syempre, we know the mechanism here. I will not discuss that in detail because I was able to discuss that few weeks ago. When the right ventricle now is filled with blood, take note this blood is deoxygenated or unoxygenated. This blood goes to your lungs. Okay? Okay? Bakit may L dyan? It goes to your lungs. Nangyari. Hey! Para akong naninibago sa whiteboard na to. So, it goes to your lungs, right? Ito pala. It goes to your lungs. So when that blood enters the lungs, nurses, anong nangyayari? There will be exchange of gases. Okay, there's this what we call external respiration. Okay, so focus muna tayo sa right side. So what will happen here? The right ventricle pumps blood going to your lungs. If a patient has a pulmonary problem, for example, a patient has an existing COPD, or your chronic obstructive pulmonary disease and it causes constriction in the pulmonary vessels, ano mangyayari? Mahihirapan ngayon yung blood to get inside the lungs. Correct? So as a result, the right ventricle now will increase its workload, okay, will increase its workload to push the blood to get inside the lungs. Okay, so that will increase the workload of the right ventricle, resulting to a condition called right ventricular hypertrophy. That is why if in your X-ray or if in your two-dimensional echocardiography or 2D echo, or if in your EKG, it shows that there is right ventricular enlargement, you may suspect that the patient has an existing pulmonary problem. Because right ventricular hypertrophy or cor pulmonale is usually related to COPD, especially a patient having a bronchitis. Okay, so again, it will increase the workload of the right ventricle. That's the scenario, the first scenario. Another scenario is when the blood fills the left side of the heart. Okay, when the blood fills the left side of the heart, the left ventricle now will pump the blood, and that blood enters your, of course, aorta. Okay, it goes to your aorta. Now, if a patient has an uncontrolled hypertension, for example, patient is not compliant with his or her, his or her antihypertensive medication because of persistent elevation in the blood pressure of the patient, it can cause increase in the vascular resistance. As a result, an increase in the vascular resistance will increase the workload of the left ventricle, causing again left ventricular hypertrophy. So tandaan lang, any part sa katawan ng tao that has an increased workload or increase in the functional demand will eventually cause enlargement or hypertrophy. So basically, when you say hypertrophy is increase in the size because it's a form of physiologic response or a form of what we call compensatory mechanism due to increase in the functional demand or increase in the workload. Okay? So again, because of increase in the blood pressure, that will cause enlargement of the left ventricle. Okay? Now, here's the third scenario. The left ventricle pumps the blood to your aorta and to be distributed in the different parts of the body. The question here is, when the blood fills the left ventricle, for example, in the left ventricle, just an example, okay, just an example, you have 100 ml of blood. When the left ventricle contracts, do you think as this ventricle contracts, okay, as the left ventricle contracts, will it eject 100 ml as well? Answer, no. So, ibig sabihin, the left ventricle contracts, but it will not pump 100% of blood inside the left ventricle. Only a certain percentage is being ejected. Only a certain percentage or volume is being ejected or pumped out. We call that as short ejection fraction. Okay, so what is ejection fraction? Ejection fraction is the percentage or the amount of blood ejected in every heartbeat. Okay, in every beat, every time the heart contracts, that's your ejection fraction. How many percent? So how many percent is being ejected when the heart contracts? What is the normal ejection fraction? The normal ejection fraction is about 55 to 70%. Okay? Other book, it's 50 to 70. So, iba-ibang libro, may kanya-kanya silang ejection fraction. But nevertheless, it's greater than 55. Okay? So, ibig sabihin, out of 100 ml, okay, just an example, when the left ventricle is filled with 100 ml of blood, it will only eject 55 to 70%. Let's say it pumped 70 ml of blood. So how many ml is left inside the left ventricle? You still have 30 ml left inside the left ventricle. So is that normal? Yes, it is. So ibig sabihin, hindi pala lahat na blood na nasa loob ng left ventricle na ipapalabas every time the heart contracts. There is a specific volume or percentage or amount of blood being ejected, and that is your ejection fraction. Okay? Now, here's the scenario. Pag yung heart hindi nang pump ng maayos, inability of the heart to pump well, as a result, because of inability of the heart to pump well, bababa ang kanyang output. Inability of the heart to pump well to meet the demands of the body. Ang tawag natin doon ay systolic heart failure. Okay? Sa systolic heart failure, since hindi nag-pump ng maayos yung heart, anong ilalabas niya na blood? Marami ba or konti lang? Siyempre, konti lang. That is why your systolic heart failure is also referred as heart failure with reduced ejection fraction. Okay? Kung may systolic heart failure, meron din tayong tinatawag na diastolic heart failure. So what is the difference between systolic heart failure and your diastolic heart failure? I already mentioned systolic. Systolic heart failure is a type of heart failure due to inability of the heart to pump, okay, effectively. So when you say diastolic heart failure, it's a different thing. Diastolic heart failure is a type of heart failure due to inability or what do you call this? Inadequate ventricular filling. Okay, inadequate ventricular filling. So the issue here is not really into pumping, but the issue here is ventricular filling. So I remember I said, let's say 100 ml. Pero sir, ang problema, hindi po 100 ml ang nasa loob ng ventricle ng patient. Ibig sabihin, there is decreased ventricular filling. So instead of 100 ml, let's say it is only let's say 90 ml. 90 ml lang na initially dapat let's say is 100 ml, right? Sa kanya 90 ml lang. Tapos ang problema sir, sa 90 ml nung nagpump na yung heart, ang naipalabas niya ilang ml. Let's say out of 90 ml, ang naipalabas niya is let's say 70 ml lang. 70 ml out of 90 ml. So ilang ml ang naiwan sa loob ng left ventricle? may naiwan na 20 ml. So how many percent is 70 ml of 90 ml? Okay, so 70, okay. So what is the ejection fraction here? What is the ejection fraction? Okay, where's my calculator? So 70 divided by 90. So that would be 0.7, that would be 77%. Okay? So if in the left ventricle there is 90 ml at ang ejection frac at saka yung output niya is 70 ml, so ilang percent ito? This is 77%. So normal ang kanyang ejection fraction. Am I right? So this type of heart failure is diastolic heart failure, or we call this as heart failure with preserved ejection fraction. Okay? Preserved ejection fraction. Okay? Kasi sometimes makikita mo sa diagnosis ng doktor, heart failure with reduced ejection fraction, heart failure with preserved ejection fraction, or diastolic heart failure, systolic heart failure. Ito yun sila. So ulitin natin ha, ang systolic heart failure, you also call this as your heart failure with reduced ejection fraction. So the problem with your systolic heart failure is pumping mechanism, okay? Inability of the heart to pump. Okay, diastolic heart failure, you also call this as heart failure with preserved ejection fraction. Ibig sabihin, yung ejection fraction you're within the range. Okay, the problem here is a ventricular filling. I hope you get my point. Now, balikan natin. Okay, heart failure is also subdivided into two, whether it is a form of right-sided or left-sided heart failure. Please allow me to clear my board. Okay, heart failure is also divided into two, whether it is a form of right-sided or left-sided heart failure. Balikan natin. Okay? So this is the right side, this is the left side. So this is the right atrium, right ventricle, left atrium, left ventricle. I said that the right side of the heart receives blood from your superior and inferior vena cava. Okay? The left side of the heart receives blood from your, of course, lungs. So when you see right-sided heart failure, ibig sabihin, the right side of the heart is not pumping well. Correct? So pag hindi magpump ng maayos yung heart sa right side, hindi makalabas yung blood. Am I right? So can you imagine that? If this is your heart and the heart will not pump well, hindi makalabas yung blood na nasa loob ng heart. As a result, that blood will continue to congest inside the heart, causing congestion. Kaya ang tawag congestive heart failure. So what will happen if there is congestion in the right side of the heart? When the blood now congests, okay, when the blood accumulates sa right side ng heart, hindi makapasok ngayon yung blood from your systemic circulation. So as a result, right-sided heart failure will give you systemic congestion, systemic manifestations. Now, what about left-sided? If the left side of the heart failed to pump well, okay? Pag hindi mag-pump ng maayos yung left side ng heart, hindi makapasok yung blood from the pulmonary area. Correct? Remember? Paano siya makapasok sa left side ng heart? Puno yung left side. So the blood now will congest in the pulmonary area, will congest in the lungs. So left-sided heart failure will give you pulmonary congestions. Okay? Now, I just want to emphasize some manifestations of a patient with right-sided and left-sided. Okay? So again, right-sided will give you systemic congestion. So here you will have your weight gain. Okay, you will have hypertension. You have a strong bounding pulse. You will end up having ascites. You will end up having edema in the lower extremities, and it goes up. Okay, and take note, patient here will have weight gain. Okay, I just want to emphasize this. It's not enough to say there's weight gain, there's weight gain. There must be a parameter, okay, for you to rule out that the weight gain is related to fluid congestion. If you gain weight of greater than 2.2 pounds or greater than 1 kilogram per day, that is an indication of fluid volume congestion or fluid volume excess. Okay. So again, that is your right-sided congestive heart failure. Okay. What about for left-sided? Of course, since it's pulmonary congestion, you will have cough. Okay. You will have dyspnea. Now, I want to emphasize dyspnea. Dyspnea. So dyspnea is a medical term that describes difficulty of breathing, right? So nahihirap ang huminga yung pasyente. Now, there are different types of dyspnea. Okay? So what are those dyspnea na patient may manifest if patient ends up having heart failure? So patient may develop orthopnea. Okay? Patient may develop orthopnea. Patient may develop paroxysmal paroxysmal nocturnal dyspnea. Patient may also develop exertional dyspnea. So these are common types of dyspnea. So you have exertional dyspnea, orthopnea, and paroxysmal nocturnal dyspnea. So let's begin with exertional dyspnea. So what is exertional dyspnea? Exertional dyspnea is a type of dyspnea or difficulty of breathing if the patient is having increase in physical activity or there is exertion. Okay? So ibig sabihin, for example, yung pasyente natin nakaupo lang, walang ginagawa, idle, okay, there is no difficulty of breathing. But when the patient starts moving, especially walking, climbing stairs, as long as there's increased physical exertion, there's increased physical demand, then that's the time the dyspnea kicks in. So we call the type of dyspnea as exertional dyspnea. There's difficulty of breathing once there is but once the patient is active. When you say active, I'm referring to patient is physically active. Okay. Now, when you say orthopnea, orthopnea is another type of dyspnea but related to positioning. So ibig sabihin, if the patient is upright, head of the body is elevated, there is no shortness of breath. But if the patient here is lying flat, okay, patient is in supine position, patient is lying flat, okay, this is the head part of the patient lying flat, okay, the patient feels like there's not feels like the patient will have or will experience shortness of breath, or the patient will experience or will complain of feeling of drowning. Okay? Para siyang nalulunod. Okay? Because of what we call positioning. Okay? Ibig sabihin, because of the position of the patient, the pulmonary air, the lungs now is subject to what we call fluid congestion. That is why a patient with this type of condition will always tell you, I need to have more pillow because I cannot sleep with one pillow. I cannot sleep lying flat. I need to have a lot of pillow behind me because if not, it feels like I am drowning. Okay. So that is what we call orthopnea. Okay. So be mindful if your patient will tell you, I cannot sleep with one pillow. I need to have 3 or more pillows, okay, under my head because if not, it feels like I'm drowning. So that could be orthopnea. Okay. What about paroxysmal nocturnal dyspnea? Your paroxysmal nocturnal dyspnea is a condition wherein during nighttime, patient is awakened because of sudden onset of respiratory difficulty, shortness of breath, and feeling of drowning as well. Now, what makes it different from your orthopnea is that in your orthopnea, it can occur any time of the day, as long as the patient is in supine position, or as long as the lungs of the patient is in the lower ground. And because of that position, that can cause fluid congestion in the pulmonary area. So it may occur during daytime, afternoon, or nighttime. So orthopnea can occur any time of the day. But in your paroxysmal nocturnal, it occurs during nighttime. Why not during daytime? Because during daytime, when the patient is active, there is no congestion of fluid in the pulmonary area. But when the night comes, when the patient is lying down, because patient is sleeping, that's the time when fluid starts to congest in the pulmonary area and causing shortness of breath, causing congestion. Okay, why is it that the pulmonary area is always subject to fluid congestion? Why? Because the pulmonary tissues, The tissues, the characteristic of one of the characteristics of the pulmonary area is that it is permeable. Remember, it should be permeable because that's where the site of gas exchange. That is why if the lungs are permeable, any slight increase in the fluid level in the body will always put the lungs, okay, subject for fluid congestion. That's the reason why. Okay, so these are the three common types of dyspnea. You have your orthopnea, paroxysmal nocturnal dyspnea, and exertional dyspnea. Okay, and because of pulmonary congestion, patient will also experience a frothy sputum or a pink frothy sputum. Patient may end up having hypoxia, decreased oxygen in the tissue. Patient will also experience or will also manifest abnormal breath sounds. Okay, so patient will have crackles. Patient may end up having wheezes. Okay, crackles is related to fluid congestion. Wheezes or abnormal breath sound, wheezing sound is usually related to airway obstruction, especially if the airway obstruction is partial airway obstruction. Okay, so those are common presentations of the patient with heart failure. Okay, and there are a lot of manifestations, especially if you have the right-sided and left-sided heart failure. I hope that's clear. If you have any questions, let me know. Anyway, bagong lahat, hello muna kay Tintin. Hello to Bariga. Hello batchmate. And hello to, hi, Sir Ian Frondosa. Kumusta po kayo? And now let's go back. Now, if a patient, okay, if a patient now is having heart failure, okay, what do you think are common diagnostic tests done to check if a patient is indeed having heart failure? There are a lot of actually diagnostic tests that will support heart failure. Okay, first, doctors would check for your X-ray. X-ray, your chest X-ray. By the way, your chest X-ray will not only evaluate pulmonary area. Okay, your chest X-ray will also check rib cage problem, lung problem, heart problem, or heart issues. Okay, so in your chest X-ray, it would reveal cardiomegaly. There's enlargement of the heart. Not only that, your chest X-ray will also reveal pleural effusion. Okay, number two, another diagnostic test that is very helpful in diagnosing heart failure is EKG or electrocardiogram. Your EKG will also reveal enlargement of the heart. Okay, so enlargement of the heart, it could be right ventricular enlargement or left ventricular enlargement. How will they know that? Okay, so if you were present during when I talk about electrocardiography, if you were my student, you can relate to this. How will the doctor know, or how will you as a nurse know that the enlargement is on the right ventricle? You check the lead V1, right? Ideally in V1, the R wave is short, okay? The S wave is tall. But if in RK, but if in your V1 the R wave is taller than your S wave, you suspect right ventricular hypertrophy. Okay, but if you suspect left ventricular hypertrophy, you check lead V1 and V5. Okay, you have to add the S wave in V1 and the R wave in V5. If the sum is equal or greater than 35 mm, you suspect left ventricular hypertrophy or left ventricular enlargement. Okay, but again, okay, you have to as well check the presentation of your patient because your electrocardiography is not 100% accurate. The accuracy of your EKG is only about 60 to 70%. So you have to correlate that with other diagnostic tests and of course your physical assessment of your patient. Okay, so again, first you have your chest X-ray, second you have your electrocardiography, third you have your two-dimensional echocardiography. This is so important, powerful. Why? Because it will also check how the thickness of the myocardial muscle, and your electrocardiography will give you an idea that what the ejection fraction of your patient is. Okay, remember I said the ejection fraction ranges between 55 to 70%. Okay, other book they have a different parameter for the normal ejection fraction, but nevertheless it's greater than 55. Okay, the higher the ejection fraction, the better. The lower the ejection fraction means more blood stays inside the heart. Okay, another is the pro-BNP. The pro-BNP is also powerful with diagnosing, evaluating cardiac abnormality. Okay, so those are actually four parameters or common tests done to patient with heart failure. Again, just to recap, you have your chest X-ray, you have your EKG, you have your pro-BNP, and then you have your what do you call this, echocardiogram. Now, to manage patient in treating patient with heart failure, the focus here the focus here is actually to increase the force of contraction without increasing the heart rate. That's the goal in treating patient with heart failure. Again, what's the goal? Naalala ko dati pag tinatanong yung estudyante, what is the goal? The goal, to top the board exam. Para tayong mga baliw. Anyway, the goal here is actually to increase the force of contraction without increasing the heart rate. Why do you need to increase the force of contraction? You need to increase the force of contraction in order to increase the cardiac output. Remember what's cardiac output? Cardiac output is the product of heart rate times stroke volume. Okay, that's your cardiac output. To increase the force of contraction, to increase the cardiac output. So that's the main goal. So how are we going to achieve that goal? May mga approaches po tayo to achieve that goal. And if you can still remember, you have your unload fast. I hope you can still remember this. For those who were my student, so review, you can relate on this. Unload fast. Where's that? Here. So this will be our approaches in treating patient with heart failure. Unload fast. Unload fast. This is an old mnemonic, but still helpful. U stands for your upright position. Okay, upright position. So technically, you need to position the patient head of the bed elevated, or you position the patient upright for two reasons. First, you don't want to end up having pulmonary congestion, right? Second reason why you position the patient this way is that with this position, it promotes lung expansion. So those are two reasons why you position the patient upright. Again, first, it prevents pulmonary congestion, and second, it promotes lung expansion. N is what we call your nitrates. Okay, your nitrates. Nitrates, of course, kung naging estudyante kita, you understand the relevance of nitrates. It's a vasodilator. Okay, L, you have your Lasix. Lasix is a form of what we call a diuretic. Okay, it's a potassium wasting diuretic. It's furosemide, right? Because it's potassium wasting diuretic, you have to watch out for hypokalemia or bababa yung potassium level ng patient. Because remember, one medication given here is your digoxin. Remember, as a nurse, you should know the relevance of potassium hypokalemia with your digoxin medication. Okay, O stands for your oxygen. Why do you have to give oxygen to your patient? To increase or improve oxygen perfusion. A stands for your aminophylline. Aminophylline is actually a form of bronchodilator. D stands for your drug of choice. What is the drug of choice for heart failure? The drug of choice is a form of digitalis, or you call this as your cardiac glycoside. It's a cardiac glycoside. Okay. One good example of cardiac glycoside, we're talking about digoxin, or you also call this as your lanoxin. If you can still remember, your digoxin has two major effects. What are the two effects of digoxin? By the way, hello to Sid Valdivieso. Hi, friend. Hello to Jade Vito. And hello to Roxanne Legaspi. Anyway, your digoxin or cardiac glycoside has two effects. And what are this? Digoxin has a positive inotropic, and a negative chronotropic. Chronotropic. So when you say positive inotropic, it increases the force of contraction. Negative chronotropic, it decreases the heart rate. So since it decreases the heart rate, you cannot give digoxin if the patient is having bradycardia. You cannot give digoxin if the patient is having hypotension, because the more it causes hypotension, the more it causes bradycardia. So you cannot give digoxin to pediatric with a heart rate of less than 100. You cannot give digoxin to adult with a heart rate of less than 60. And take note, I said heart rate. So one nursing responsibility here is to check the heart rate of the patient in 1 full minute. Okay. You mentioned a while ago LASIK surgeon. Yes, I did. And I also mentioned potassium. What did I tell you? The relationship of your potassium and the digoxin. Remember, I said this for several times when I had my online classes. Hypokalemia or a decrease in the blood potassium level potentiates the effect of the digoxin. It means to say that when the blood potassium level is low, it increases your digoxin effect. It increases your digoxin uh, effect. Okay, it increases the medication digoxin. So as a result, if it potentiates the effect of the digoxin, as a result, it increases your likelihood to develop digitalis toxicity. So just don't forget this. If your patient digoxin, monitor potassium because when potassium in the blood is slow, okay, not slow, when the potassium in the blood is low, mababa, okay, less than okay the normal level, it increases your likelihood to develop digitalis toxicity. Okay. And if you have digitalis toxicity, we know that the antidote is your digibind. That is your digoxin immune fab. Okay. So I want to talk about the signs and symptoms of digitalis toxicity. That is for a different concept. Let's just proceed with your unload fast. F stands for your fluid restriction. Why do you have to restrict fluid? Because again, there is what we call congestion, right? A stands for your afterload decrease. Afterload decrease. Why do you have to decrease the afterload? Decrease the afterload in order to prevent, okay, in order to prevent this what we call congestion, okay? In order to prevent congestion. But decreasing the afterload is not good. It's not good, okay, in some patients, okay, but for specific for heart failure, decreasing the afterload will prevent or decrease congestion in the heart. Okay, so how will you decrease the afterload? Of course, fluid restriction is one. Okay, what else? You give medication, you give you give Lasix, okay, you give diuretics, you may give vasodilators, you may give ACE inhibitors, okay. There's a practice before, it's an old practice. We no longer do this, okay. It's an obsolete, okay, it's an obsolete practice. I haven't seen this one being performed, okay. It's an old practice. We call this as rotating tourniquet. Others, they will say rotating tourniquet, okay, or rotating tourniquet. So we have four limbs, we have four extremities, two uppers, two lowers. So in your rotating tourniquet, what they do is that they put tourniquet or tourniquet in 3 out of 4 tourniquet, 4 extremities, and they rotate the tourniquet every 30 minutes. Okay, we cannot remove all tourniquets at the same time. We have to remove that one at a time. The reason why you do that is to decrease afterload. But again, we no longer do, we no longer do, or we no longer practice the rotating tourniquet, okay? Because we already have medication nowadays. See how powerful medications are. S stands for what? Sodium restriction. Sodium restriction. Why do you have to restrict sodium? Because sodium attracts water. The more water you have, then you will end up more water congestion, right? That's common sense. And T stands for what? Tests, not testicles. Test for what? Test for your potassium, okay? Test for your digoxin level, okay? Digoxin level. So test for potassium and test for digoxin level. You can also do test for your what? You may also check for your ABG if you want. Okay, what do you have to check for potassium? I already mentioned this. A decrease in the potassium will increase the effect of your digoxin, increasing the risk of toxicity. Digoxin level is 0.5 to 2.0. Okay, greater than that indicates digitalis toxicity. And I said the antidote is your digibind, that is your digoxin immune fab. You may also check your ABG, especially for patient having hypoxemia. Okay, so again, these are the different approaches we use, we follow. Okay, but the main goal here is to increase the force of contraction, increase the force of contraction without increasing the heart. Increasing the force of contraction without increasing the heart. Or by the way, guess what? What is the action of redigoxin? The action of redigoxin is the goal in treating heart failure. So again, what is the goal? The goal is to increase force of contraction without increasing the heart rate. Guess what? This is the action of your digoxin. That makes digoxin as the drug of choice. Why? Because the action of digoxin is the goal in treating heart failure. Okay, I hope that makes sense, everybody. I hope you learned something. And of course, I hope, Oliver, naintindihan mo yung pinagsasabi ko dito. So ito yung heart failure na tinatanong mo kanina, especially yung systolic heart failure, yung diastolic heart failure, remember, systolic heart failure, you call this heart failure with reduced ejection fraction. Diastolic heart failure, you call this as your heart failure with preserved ejection fraction. I hope you learned something, guys. Okay, I think that's all. God bless everybody, and I hope you learned something, guys. Do you have any questions? Kung wala, yun lang po. Maraming salamat. I hope you learned something. Again, don't take this as your sole management treatment for whatever cardiac abnormality you have. You need to go to your cardiologist, talk to your doctor because they know the case more than anyone else. Okay? And please do not self-medicate. Okay? You may have a friend suffering from the same illness, the same problem, but take note, hindi ibig sabihin kung ano yung gamot na binigay sa kanya, applicable din sa'yo. Okay? Because every patient is unique. You have a different background. So doctors may use a different approach in different patients. Okay? God bless everybody. Thank you so much for staying. If you reached this far, thank you so much. And please now, feel free to drop a message if you want me to discuss any medical surgical nursing concept. And to all my students, I will see you very soon. God bless everybody. Keep safe, keep warm wherever you are.